Bracing for a surge within a surge.
Tonight we're hearing from a longtime ICU doctor about details for the plan his hospital has for the potential post-holiday spike in cases.
News 8's Heather Hope has the story.
On the front lines of COVID, we hear from an ICU doctor describe the horror he says he sees every day with increased cases in coronavirus, a stretched thin staff, and a bed capacity already at a maximum.
It's just extraordinarily explosive and dangerous right now.
At a breaking point.
Almost close to 2/3 of our entire population in the hospital is COVID positive.
Dr. Scott Eisman, critical care specialist for Scripps Memorial Hospital Encinitas, says COVID-19 cases have spiked so intensely in the last few weeks that there haven't been any signs of stopping.
It's the opposite. It's increasing very rapidly, and the severity as well is also very rapid. The impact it has on other patients who don't have COVID and their ability to get care is profound.
And not just in the South Bay of San Diego County, the North has also seen a severe surge. Dr. Eisman says the Scripps ICU in Encinitas is running at 183% of its normal licensed beds.
Nobody's been spared. It's been like this in Los Angeles. It's like this in South County, Imperial County. It's a crisis everywhere. In some places, it's more of a crisis than others, but it's a crisis everywhere.
Even with the vaccine out, he says the calls for social distancing, hand washing, mask wearing, and no large gatherings can't be ignored.
Everybody has to do that because it has gotten to a point where we are pushing the limits.
But what about the impact that recent busy holiday travel could have on hospitals already overloaded?
Scripps Health has hired a lot of new nurses and staff, respiratory therapists to make sure we're prepared for this.
As for the UK strain of coronavirus, which is said to be more infectious, Dr. Eisman says it comes at an already challenging time.
It is one more thing among an already extremely bad situation.
A member of the Scripps healthcare system since 1986, Dr. Eisman says the pandemic packed cases in ICUs is unlike anything he's ever seen.
We feel for our patients, and we don't want to see this become something that is even worse than it already is.
Heather Hope, News 8.